Okay, and now we're going to be switching over to Emily Gibson. Emily is the medical director and family physician at Western Washington University Student Health Center. So, Emily, could you take it away?
Yeah, I'm really inspired by what Stacy just said, and it's really what fuels my staff's interest in helping college students who are really very new and naive to their own managing their own health care, to have them just simply have an expectation that their notes will be shared with them. So we're about 4 years into our open notes system. I'm a family doctor and director of the Student Health Center here, 16,000 students. But because of the demand everywhere for mental health care in college students, about a third of our students have a mental health diagnosis, and majority of those are actually in active treatment, either medication or therapy or both. We have to do a lot of mental health here in our primary care clinic. So the medical chart here is completely open to the student with a few limitations that I'll talk about. I'm now doing behavioral health full-time because of the demand for that kind of care, and that's primarily medication management. We are not doing therapy here in the health center. We have a counseling center that does some limited brief therapy with social workers and psychologists, but most of the students who need ongoing therapy are referred off campus. So we're not talking about therapy notes. We are talking about mental health, behavioral health, assessments, evaluations, including psychiatric providers in our clinic. So that's what students are seeing. And they're seeing these notes just like they see their medical visits. And so they don't see this as being somehow different or unique or special because they just simply have access to any of their notes. We have the option with our current EMR to either give them full access to the full note or a partial note. And we let the student know that they're either able to view a full note or a partial note. And I have 4 psychiatric providers who work here coming in from private practice. They spend a day or 2 a week here, and the vast majority of those providers feel more comfortable with a limited note. Now, a partial or limited note would include the diagnoses, basically the axes, and the treatment plan. And if the student actually wants to see their full note, they can request that, and we make arrangements for them to be able to see their full note. So my notes, since I'm a primary care physician and I'm approaching my behavioral health assessments pretty much like a primary care physician would, I share the whole note. It's very unusual that I would feel like a student should not see their full note. We make sure that students are reminded that they have their notes available to them, and we track this, and 90% of our students do read their note within a 2-week period. If they haven't read it after a week, we send out an email that reminds them, hey, you've got a note to review. And then if they haven't reviewed that note after 2 weeks, we do a text or a call just to remind them that they have a note to review. This is pretty critical for us because just in terms of being able to do in-clinic follow-up, we just don't have the space for all the students that we need to take care of. And so a lot of our care and check-ins are by patient portal visit. So we're doing messaging, and we really want the student to understand the treatment plan through the portal itself. So that's how a lot of our care is delivered, is actually through this messaging. So students, the patients love having the access. They rarely have questions about what they see in the notes. They sometimes have clarification, but otherwise this has been a very successful thing for almost 4 years now, and we will continue it. And in the future, we're going to be integrating with our counseling center, where we're going to be sharing an electronic medical record system. And I'm hoping that my colleagues over at the Counseling Center will be willing to allow some access to their therapy notes. primarily because these are crisis notes and they are brief therapy. They're not long-term therapy, and so I think they're probably going to be more amenable. But at this point, we just are not on the same system, so we can't do this yet with the actual therapist. So that's our experience here.